Moving on to the manual psoas release. This is an excellent technique for many people, but it is not a fit for everybody. While it's normal to feel some discomfort and tenderness with this technique, there shouldn't be any sharp shooting or stabbing pain. There shouldn't be any numbness and tingling, both in the pelvic region as well as down the entire leg. So be sure that your client or patient is comfortable reporting their symptoms to you along the way. Okay, first, with your client lying comfortably on their back, ask them to bend their knees with their feet flat on the table. Start by placing your fingers along the front of the iliac crest, just at the ASIS. And gently run your index and middle finger down along the inside of the iliac fossa until you're feeling the psoas. And gently, very lightly, lift your knee up in the air, just about an inch. Good, and back down. And I felt the psoas pop up into my fingers, so I know that I'm in the right spot here. Now, with very light pressure on the psoas, ask your client to take a medium breath, inhale through the nose. So go ahead and inhale, good. And then exhale out the mouth. And that gives you a sense of what happens in this area with a medium-sized breath. Now on this next breath, I'll add a little more pressure on the exhale. And again, go ahead and inhale through the nose. And I'm just holding my pressure steady. As she exhales, then I'll sink a little bit farther down into the muscle. You okay? Okay, good. And then relax again. Progress this technique very gradually. As you gain familiarity with this technique, and as you and the client work together for longer periods of time and they become more comfortable with the technique, you can try adding a little bit more pressure with each subsequent breath. I suggest starting with 3 breaths. Work your way up to 5 breaths. If this feels good for your client and you both think it would be beneficial to do more breaths, then that's great. You might work up to 7 breaths or even 10 breaths. I recommend performing this technique on both sides, even if only one side is symptomatic at the time. Now, if that basic release feels good, we can progress this. We'll be applying light pressure on the inhale, and then as the person exhales, we're going to add movement. First with the leg and then with the arm. So we'll be mobilizing the more inferior fibers of the psoas when the leg moves, and we'll be mobilizing the more superior aspects of the muscle when the arm moves. So first we'll start with leg extension. So I'll go ahead and find the psoas again by running my index and middle finger along the iliac fossa. Now this time, Jade, when you still do a medium breath, but when you exhale, slowly lower your right leg down. So now I'm on the psoas. Go ahead and take a medium breath in, good. And as you exhale, slide out, and I'm applying a little bit more pressure to the psoas. Then I'm going to release that extra pressure so that I'm barely touching the psoas, and go ahead and lift your leg up. And let's do another breath. Inhale through the nose, medium breath, and exhale, slide your leg out. And I'm applying just a little bit more pressure, maybe about 5% more than I did last breath. Good, and relax. And let's go ahead and bring that leg back up. And if the person needs a little bit of assistance bringing their leg back up to the starting position, you might just assist right underneath the knee. So as they lift their leg, you may just apply a little bit of assistance right behind the knee. Now we'll add the arm motion. All right, so I'll sink into the psoas. Go ahead and take a medium breath in through the nose. Good. And lift your arm up. And I'm applying a little more pressure to the psoas. Good, and relax. And I'll ease up my pressure. Bring your arm back. Okay. Now, starting with a light touch on the psoas, take a medium breath in through the nose. Good. And when she starts to exhale, I'll apply more pressure as she lifts her arm up over her head. Good. And rest. Yep. And bring your arm back up as I release some of that pressure. I also recommend starting the pin and stretch techniques with 3 breaths. Add a few more repetitions if you find this technique to be helpful and if your client feels comfortable with progressing this technique.
If you found this video useful and want to see more like this, make sure you subscribe below and don't forget to hit the notification bell.